like to welcome everybody to the follow-up meeting of the Compliance and Consumer Confidence Task Force. The last time we met was back May 8th, right before Mother's Day. So welcome everybody. I don't know if Mayor Demings is connected because I think he had a few brief remarks.
Let me go check on it.
Okay. In the meantime, I'm going to have Pastor Zach, my co-chair, go ahead and do roll call.
Thank you so much. Good afternoon, everyone. So we're going to call the roll. Augusto Sanabria with Prospera. Augusto Sanabria. Okay. Steve Jameson with the Millennium. Steve Jameson. Dan Ward with Curly and Penn.
I'm here, thank you.
Thank you. Tricia Johnson with Seminole County Government. Tricia Johnson. Okay. Wayne Rich with Nelson Mullins. See him, Wayne Rich. I see him, he's present. You just need to unmute. Inez Long with the Black Business Investment Fund of Florida. Inez Long. John DeArmas with Profit Land Partners.
Present.
Great. Chris Earl with the United Safety Council. Chris Earl.
Yep, good afternoon, I'm present.
Major Robert Ensueño with Orange County Sheriff's Office. Major Robert.
He has it on, but he's having issues with sound.
Enter your access code or meeting number followed by
We need you to mute your feed, please. Okay. Nadine Tarpley with Uso Jazzy Hair Salon. Nadine Tarpley. Rich Costellos with University of Orlando. Rich Costellos with University of Orlando.
I am here.
Great. Phil Brown with the Orlando International Airport.
Present.
Great. Chuck Woodall with Unicorp. Chuck Woodall. Bradley Gilmore with SeaWorld Parks and Entertainment. Bradley Gilmore.
Good afternoon, I'm present.
Wonderful. Monisha Brown with Walmart.
Good afternoon, present.
Michael Thomas with John Michael Exquisite Weddings and Catering.
Good afternoon, present.
Jesse Martinez with Alphon Inn.
Present.
John Madison with Orange County Farm Bureau.
Present.
John DeArmas with Profit Land Partners.
I was already called in, but good afternoon. I'm here.
Wonderful. Frank Goko with Wyndham Destinations.
Present.
Wonderful. Dan Giordano with Rose and Shingle Creek.
Afternoon, Pastor Zach, present.
Thank you. Conrad Santiago with Trenton San Diego Group. Conrad Santiago. Florencio Larry Rodriguez with Don Julio's Mexican Kitchen.
Present.
Wonderful. Dr. Raul Pino with Florida Department of Health in Orange County. Dr. Raul Pino. Alan Johnson with the City of Orlando and Orlando Venues. Alan Johnson. Kerry Burns with Florida Restaurant and Lodging Association.
Present, Pastor Zach.
Wonderful. Dr. George Rawls with Orlando Health. Dr. George Rawls. Dr. Vincent Sue with Advent Health.
Yeah, present.
Thank you. Dana Elisa Green with Full Sail University.
Present.
Wonderful. Jessica Henlon with Full Sail University.
Good afternoon, I'm present.
Jay Galbraith with Valencia College. Jay Galbraith. Esther Percival with Valencia College.
Present.
Shannon Gravite with Advent Health. Shannon Gravite.
Present, thank you.
Wonderful. Sam Stark with Rollins College. Sam Stark.
Hello, good afternoon.
Okay. Manny Rodriguez with Rollins College. Manny Rodriguez.
Yes, I'm present.
Wonderful. Sabrina LaRosa with UCF.
Good afternoon, everyone.
Fred Kittinger with UCF.
Present and good afternoon.
Reginald Green with Florida A&M University.
Present,
Wonderful.
Pastor Zach.
Thank you. Julian Maynard with Florida A&M University. Julian Maynard. Lorene Martinez with OEP. Lorene Martinez.
I'm here. Thank you.
Becca Beatis with Visit Orlando. Becca Beatis with Visit Orlando.
I'm here.
Are there some? I think I saw a few others who are not on my list, but that concludes my list. If you could indicate that you're present.
Good afternoon, Augusto Sanabria with Prospera here.
And this is Chuck Whittle. Did you hear me announce myself?
No, but that's great. Thank you.
And Steve Jameson is also on the call for the record.
Okay. I see Harold Mills. I didn't call his name, but Harold Mills, I see him here.
Thank you, sir. Pastor Zach, I am here.
Thank you. Okay, that concludes the roll call. Back to you, Dr. Cardenas.
Thank you, Pastor Zach. Before we continue with the public comments, Mayor Dennis. Yes.
Evelyn?
Yes, go ahead.
I apologize for interrupting you. We're having a very hard time hearing your audio. And for the rest of the participants of the working group, just be mindful to be as close to your audio as possible so that the Webex feed can pick that up. And in addition, Orange, if they can't hear you at the moment. So if you can be as close to your audio as possible and speak up, everybody. It would be awesome. Thank you, everybody. Appreciate it.
Same here.
Okay. Is this better? Is this better?
A little bit. And just from the Orange County Sheriff's Office.
I'm trying to switch the audio.
I see Mir Demings online now, so you can call on him Like,
Yes, sir. I'm online now, Pastor.
She needs to fix
Got my video on at the moment.
Okay, and we'll allow this time for Mayor Demings.
All right. Are you all ready?
Yes, please continue.
Yes, sir.
All right. Let me just say thank you once again for your willingness to volunteer and to assist us with our reopening efforts here within Orange County. Obviously, we've hit a little bit of a snag with the new cases that have been reported over time. And I can tell you that we saw a little bit of something positive today. When we look back within the last 14-day period of time, we saw double-digit increases almost on a day-to-day basis. In fact, we saw triple-digit increases in the absolute numbers day over day. Today we had within the 24-hour period of time from yesterday, we had 300 new cases in Orange County. The day before, it was in the 340 plus range. The day before that, we had some 700, 800, 900, 1,000 cases. And so as we see now, the 300 cases, 14 days ago when we started seeing that within our community, it was alarming to me because we had been seeing cases that were new daily cases that were 20 to 30 to 17 to single digits. And then all of a sudden really with the testing post Memorial Day period of time, with the demonstrations that we saw as a community, with people going through what I call COVID fatigue, where over time they just got tired of being at home, not going out and socializing. They got fatigued and they got a little restless and they got careless in that process and were not wearing masks. We had conflicting, I think, direction from various leaders in America, from high offices that were right down to the states and local offices, who just didn't believe in the science behind what was being said or done. And now I believe that people have become much more sensitized as a result of it because of the widespread that we've seen, the increase here within our community now. Everybody knows somebody who tested positive. We've had some local elected officials who tested positive, and they've shared that publicly about their respective experiences. And it has impacted our reopening efforts. It has slowed it down. So I think the fundamental thing that we could do is the wearing of masks, continuing to have social distancing as we reemerge through our economic efforts, refocus on the sanitary measures that have been put in place. We can bring the numbers back down to a manageable level. So today was the first day that I really felt more encouraged with the numbers, even though we still had 300 new cases. The positivity rate is something that I will monitor very closely. The second thing that we will monitor very closely is hospital capacity. So earlier today, I had a phone conversation with some of the hospital CEOs here within the area. They are beginning to see an uptick in hospitalizations. While it's still well below capacity, many of the average age of the people who are being hospitalized has gotten younger over time. So these are people who theoretically have been healthier, who it was believed that the virus would impact them less severely than senior citizens, et cetera. But we know within the last 10 days, we've seen some young adults in their 20s who have been hospitalized, and in some cases, they were only in the hospital one day and they died, which indicates that the lethality of the virus is significant. And what makes the determination whether somebody recovers or dies, I think that's still out based on the research that's available. So what I see is that this has now necessitated the reconvening of our economic recovery task force with some bright minds to kind of relook at as we move forward. You know, we're still currently in what the governor says is phase 2, the full phase 2. I don't believe that we'll be going to phase 3 as a state anytime soon because every major metropolitan or urban county around the state of Florida is now being faced with a similar experience that we have. So when you make changes in public policy, you have to kind of evaluate those changes for at least a 14-day period of time. And so as we have put mandatory face covering orders in place and done some other things, we'll have to take a pause to see whether or not any of those directives had any influence, positive influence on our experience. And so with that, I'm saying to all of you, I think there's still a need to have this body constituted and taking a look at it from how we re-engage with gatherings, from community events to the houses of worship and other things. Orange County has tried to make certain that in the interim, we have provided some crisis assistance dollars to small businesses, to individuals and families, and that process is going well. We have tried to make certain that we have saturated our community with the PPE that is necessary for people to be able to re-engage if they don't have the ability to purchase face coverings or hand sanitizer. We have put over 6 million pieces of face masks out in our community within the last probably 3 weeks or so, when we have a permanent resident population of about 1.4 million. And so we're continuing to attack this virus from multiple angles. So with that, that's kind of the briefing I wanted to give you why we're doing what we're doing, and we're going to continue to monitor the progress in the coming days. Any questions of me?
Okay.
Dr. Cardenas, no questions?
Not yet. Not yet.
Not yet. Not yet. Okay.
Thank you for that summary, Mayor. It sounds really positive, the fact that it seems like we're going back to declining results. You know, I'm excited about that, and I'm assuming that hopefully everybody else in this group is as well. And thank you, Mayor. We're honored to serve, and I think everybody in the group would probably feel the same way, that we're happy to help out throughout this process to get our community back up and going. So if nobody has any questions for the Mayor, I'm going to proceed with the agenda. And everybody can hear me fine, right? Because we were having some audio issues in the beginning, and I switched out my source. So, okay, nobody's complaining. Yes.
Dr. Pino only has 10 minutes that he can stay on the call. So would it be possible to move him up in the agenda so that we can hear from him before he has to leave?
Do you want to do him now before public comments and minute approval?
Can we do that, the public comments and minutes after that? So, because he's only got 10 minutes.
Okay, so we have no public comments. So we could probably do them now before approval of the minutes. So I'm okay with that.
Okay, I'm here. Sorry that I have to jump into another call, but we are exploring with some internet providers the possibility of doing different approaches to data monitoring and trace investigation. So you will be excited if we hear that, if we get to achieve that. So you are going to see the first graph. I mean, the mayor has become excellent with these numbers, and he just gave you my whole speech, but I'm going to try to do a little here. So there you have the data for the last 14 days that the mayor was talking about that has given us a little bit of hope. I mentioned to him on Monday or Sunday that we don't want to be too optimistic, and but there are signs there for the 28th and the 29th that something is happening because the reduction was significant. Part of you see here could be as a result of the masking order, because it really coincides basically on the 7th day. That order was put in place. It came into effect on the 20th in the morning, and today is the 29th. And 7 days right into, we saw that decline. But also you have seen in the bottom of that page that it has been an increase in the number of hospitalizations, ER visits, and which is always runs a couple of weeks, a week behind the increase in the number of cases. I also would like to show you some other data points. They are coming, and this is please don't take pictures of this image. There are some information there that should not be openly shared. This is a dashboard that a few people have access to it. Part of the issue is confidentiality of bed inventory, as a could be used as targeted for other issues if someone wants to overwhelm our systems. But we have a capacity of 4,751 beds in our county right now. We still have 435 beds available to us, and we still have 519 ventilators available in the county. We also have 57 ICU beds. We have 12 isolation beds. We have 400 acute beds. We have 27 pediatric beds, and we have 8 long-term care facility beds. And this is including everything that is happening and also with elective procedures. So it's safe to assume that if we need to increase the number of beds for whatever reason in the near future, the first step the hospital will take probably will be to stop elective procedures before we even plan for surge capacity, which is not needing our county, even though our numbers are higher for hospitalization than they have ever been. But it has been a shift. People has not been as sick. They are a little bit younger, and they are requiring less intensive care. So those are some of the trends that we are seeing in our data that is important. I also know that there are other providers here with us that probably will give you some information. I want to give you hospitalizations as a last night for our county. So here we have today, last night at 5 o'clock, we have 290 cases, 290 people hospitalized. That was an increase of 40 from the day before. And that's a significant increase overnight for just COVID. And this is also ICU use. And not everyone is in a ventilator here, so you know, but a lot of people are. And in ICU, we have 64 patients as of last night at 5 o'clock. This is our epi curve as it's going. And well, you see the peaks here, and it continues to elevate. It gets updated every week at the end of the week. And this is our daily curve. So there are some good signs there. Hard to see in the middle of those, but it is there. And this is one that the mayor and I follow closely. We don't look too much at the overall because it's accumulative, but we have designed this data here. It's a rolling 14-day average. And our rolling day 14 average for today, it is 15.3% positivity rate. That is on the last 14 days, the last day of the 14 days going backwards, we have 4.24. So there is a significant increase in positivity rate that can not only be explained through testing, but also through non-compliance with some of the CDC guidelines that were put in place, or with opening places above what it was said, and the non-use of masks and other social distancing and hygiene protocols by some of the establishments that were open, and all that was in the news, so I don't need to repeat any of that. But this is where we are. If anyone has any question that I can quickly answer, that would be great. Thank you.
Dr. Pino, it's Chris Earl. I do have one question.
Sure.
Great job on the graphs and everything, but I'm hearing, and this is what I'm hearing, how many false positives are out there? And if you are being, or if they're identified as false positives, where's the follow-up testing happening? Or is that happening? Again, it's a rumor I'm hearing. There's a lot of false positives out there, and I'm just asking the question. Thank you.
Yeah, sure. So with the that's a good question. With the PCR, there is little room for false positive, although it can happen. But also with the other test labs, where you can get more than false positive is false negative, and that could happen. But those are rumors with regard to the false positive, and they being counted. The system is designed to not have double cases. The rumor mill before was that cases were being counted double, that the data gets clean, and that's why the data varies from day to day, 20 cases, 15 cases, because we get to clean it and have the ability. Also, we receive a lot of cases, and I don't know if this will count what people are saying for positive. Sometimes because we have a regional center here at the convention center, cases that may not have the adequate zip code or address get assigned to our county, even when they may not be, but our county resident, because they were tested at the county. But we have also the ability to clean those cases and to assign it to the county that we at the end determine that they are from. So that's why the data sometimes vary from day to day.
If I may suggest, and just a suggestion, because of all the rumors that I'm sure not only myself, but a lot of maybe the committee members are hearing about the false positives, maybe in your next press conference, that maybe you or the mayor address that and try to clarify it a little bit so the general public understands that you're aware of it, and maybe just try to calm the rumor mill, if you will.
Sure. I would do.
Any other questions for Dr. Pino? The only question I had, and I think you might have answered it already, is the turnaround time for the results. Just so, when we see a spike, is it from a couple of days ago? Is it from tests coming in at a different time period?
So that's another very good question. So in my professional opinion, this is personal opinion, A test that takes 5 days and infectious disease to come back, it becomes irrelevant because a lot of transmission did happen during that period. With that said, some of the tests are getting late to us in part because the increased volume and is creating a bottleneck at the labs with the capacity that we have to process those labs. But it varies from lab to lab. But we go by the day that we received the test, not by the day that it was performed. But yes, we are receiving delay in testing. Yes.
So the results, and I was speaking about the results. So the results for 300 cases today, is that from tests that were processed a week ago?
It could be.
Do we know?
We can know. We will know. We internally know when that happens. We don't disclose that in the data because it will become very complicated, or reassign the cases to the day that were tested. So the agreement, and with data, you have to agree in specific protocols and follow those protocols so that it's standardized the way that you collect it. And the agreement in the state at the beginning was that it would be the day that we receive the results, not the day that the results were performed.
Yeah. Okay. It's just to see if the masks were working, you know. So if we're getting 500 today, is it 500 because the masks aren't working, or is it 500 because it's just a delay in transmitting the data? And that was the only reason for that question.
Dr. Pino, I have a question. Chuck Woodall, how are you?
Good. How are you, Chuck? It would be a miracle if you don't have one.
I know, I'm inquisitive. You know, I look at the charts every day from the Florida Department of Health, and when you watch the curve line, it seems the peak also followed the age group decline, which, so as we got higher in cases, the age group went lower in age, which leads me to what we talked about last week in our task force call, that the younger people that were gathering at the bars and the protesters caused the spike. And so, you know, with the decline, I mean, obviously we're all hopeful it stays down, but if we see the decline stay low over the next week, would you take the same logic that closing those bars where there was very close contact may have been the reason we did what we did?
Yes.
Because we seemed like we were on a good path prior to that.
Yes, I think that we are seeing the effects of the masking, and later in the week, we can continue to see the effect of reassessing the openness of some institutions that are more likely to contribute to transmission due to the type of environment. But you're right, it should be getting older as well. So we are watching for that, yes.
Okay. If there are no other questions for Dr. Pino, I think we can continue with the agenda. Dr. Pino, thank you so much for that information. It's very helpful.
My pleasure.
Okay. So since there were no public comments, I'm going to go into the approval of the minutes. So you should have received a copy of the minutes from the last meeting. Are there any comments or questions on the minutes? Okay. Then do I have a motion and a second to approve the minutes? Motion?
You have a motion, Chris Earl.
And the second?
Second, Augusto Sanabria.
Okay. Can everybody unmute yourself if you're in favor, say aye.
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 Aye. Anybody opposed? Nay?
Aye.
I think that was just a delayed approval, okay? The minutes are passed, and now I'm going to hand it over to my co-chair, Pastor Seth, for the health update.
Thank you, Dr. Cardenas. We also have presentations that are going to be made by Dr. Sue of Advent Health, as well as Dr. George Rawls of Orlando Health. So if they could proceed in that order, we greatly appreciate it.
Hi, good afternoon. I'm Vincent Hsu with Advent Health. You know, Dr. Pino had already presented a very comprehensive landscape of what's going on, not just in the community, but also in the hospitals. At Advent Health, we are currently at our highest number of hospitalized patients that we have had since the pandemic started. About 3 times our initial peak in late March, early April. Again, to reiterate, we closely monitor every aspect of care to make sure that we are able to handle the situation. So issues such as enough personal protective equipment, make sure that we have enough staffing, enough beds, and ventilators, tests for COVID. Those are the essential items that we are looking at, and so far we are able to manage that. However, clearly, if the cases continue to go in an upward trend like they had been this weekend, at some point you would not be able to handle that. Currently, we are still able to handle that. The one thing that I do want to state, in addition to what Dr. Pino had said, is that generally hospitalizations have a delayed effect based from the time the cases were diagnosed. So if cases were diagnosed earlier over the weekend, you don't see that necessarily translate into hospitalizations until several days or even a week or so later. So we do expect an upward trajectory for the foreseeable, for the next few days, until at some point the community cases start going down. We'll see a delayed effect. Hopefully we'll see the hospitalizations go down. And as Dr. Pino mentioned, even though the hospitalization ages are going down in terms of the median age of those that are hospitalized, just like community cases, they tend to be a little bit older than the average or the median age that's diagnosed in the community. And that makes sense because generally the ones that tend to have more serious consequences are those that are are older. So we're seeing a little bit older age range compared to those that are diagnosed in the community. But overall, those trends have been decreasing month by month. And that's all I have for my report. I'll turn it back to Pastor Zach.
Thank you. So we have Dr. George Rawls of Orlando Health. Thank you, Dr. Shu.
Pastor, I don't think Dr. Rawls was able to make the call today.
Okay, so now we have the review of Orange County Executive Order.
Dylan, are you on?
Hey, might need to get myself up on mute, huh? So thank you, Pastor Zach. Now we're going to have Dylan Schott, Assistant County Attorney, for a review of Orange County's Executive Order 2020-25 requiring face coverings in public places. Thank you, Dylan, for being here, and you're recognized. Dylan, you're on mute.
Dylan, you're recognized. We unmuted you.
Can you hear me?
Dylan? Yeah, yes. We can hear you.
Sorry, I was calling in on my phone here, but that's all right. I can do it via Webex.
Dylan, are you still there?
Yeah, can you hear me?
Now I can.
Okay, sorry. I had it pulled up on my phone here, but it didn't seem to come through, so I'll do it through Webex. I'll briefly go through the Mayor's Emergency Executive Order 2020-25, which is the requiring of face coverings. The order defines face coverings as a uniform piece of material that securely covers a person's nose and mouth and remains affixed in place without the use of one's hands. It requires every person in Orange County to wear a face covering consistent with the current CDC guidelines while in a place that's open to the public whether that's indoors or outdoors. It does sort of touch on or draw a distinction between your standard cloth face covering, which is what is recommended by the CDC, and a more surgical or medical face mask like the N95, and it encourages people to use cloth face coverings as recommended by the CDC as opposed to those N95 masks. Let's make sure that those medical surgical masks are available for the healthcare professionals that need them. The order touches back on the previous emergency executive order 2020-12, which the mayor issued several weeks ago, which required employees and patrons who come within 6 feet of each other to both wear a mask unless wearing such a mask would impede in the patron's service. So, for example, going to a restaurant or something like that. The order does have some exceptions to the face mask requirement. One's for young kids, people under the age of 2 years old. One is for people that may have a health condition or any sort of, if wearing the face covering would cause an impairment, then those people are not required to wear a face mask. If someone works in a profession where they don't have any face-to-face interactions with the public, they're not required to wear a face covering. There's a few other exceptions in there as well. If it's not compatible with the duties of the profession, whether they're observing social distancing and exercising, then you're not required to wear a face covering in that instance. And then if you're developmentally unable to comply, such as children, then you're not required to wear a face covering either. The order does also have an exception for employees and patrons of certain industries, if those industries have their own face covering policy in place. So, for example, the order mentions governments, and a lot of governments have their own face covering protocol in place. I just got off the phone with Orange County Convention Center, and so they have their own face mask policy in place. So that in that case, a person would follow that particular facility's face covering protocol as opposed to the order. The order is in effect here in Orange County, and but there is an exception if there's any if it conflicts with any orders that come out in the future. As of now, there haven't been any orders issued by the governor that I'm aware of that are conflicting. But in the event that there are, then from the President of the United States or the governor, then those would be controlling. But as of now, it's in effect in Orange County, and will be in effect until rescinded by the mayor. So that concludes my review of the order.
Okay. Thank you, Dylan, for that. Does anybody have any questions for Dylan? Okay, if there are no questions for Dylan, I'll hand it back to Pastor Zach for the next item on our agenda.
Thank you, Mr. Schott. Thank you, Dr. Cardenas. We're about to have an update on the regional branding campaign. I had the opportunity to serve on the regional branding campaign committee, and today we have Becca Vidas with Visit Orlando and Lorene Martinez with the Orlando Economic Partnership for an update on the Safer, Stronger Together campaign. So you all go ahead and proceed. Thank you.
Thank you, Pastor Zach. This is Lorene Martinez speaking. I hope you all can hear me. And thank you for your time on the committee. I think there's several people on this call that served in that committee over the past couple of weeks. So thank you for your input. We wanted to share an update since the campaign launched on Friday at the mayor's State of the County address. So the first thing I wanted to do was share the final creative that the campaign is using. So if you go to the next slide, I want you to be able to see what the Safer, Stronger Together logo looks like in case you haven't already. This logo, as many of you know, was the result of numerous discussions and the input of close to 100 people who took part in the task force and the discussions on the Safer, Stronger Together campaign. You know, this includes some very bright colors where the orange is stacked with the word together to emphasize that this is a community unity type effort. Based on this, we've also incorporated the hashtag Do Your Part Orlando. So it's a very action-oriented hashtag, and we think that is being really useful in the campaign. So we created a toolkit that is housed on a website that is multilingual. It has several resources that businesses and residents throughout the region can download. And I should also mention that it is a regional campaign strongly focused on the MSA, which is Orange, Osceola, Seminole, and Lake counties. So you'll see an example there in the next slide too of the Spanish logo, Más Seguros, Más Fuertes Juntos. And we also have the hashtag Haz tu parte ORL as part of that as well. And then I wanted to share with you some of the ways that we can use this message. So the next slide, you'll see what is essentially the art for a digital banner, also a billboard, and then also the art that is included on masks that people can actually download this art from the website and use. So we feel like we had a very successful launch. On Friday, there were a number of tactics that we deployed, and we're seeing a lot of people utilize the hashtag and the campaign. And of course, we have plans to have it continue to build, particularly as our numbers are up for the region in terms of the number of positive cases, and also as we head into a very busy holiday weekend. So one more asset that I wanted to share before I turn things over to Rebecca, who can give you more information on what the campaign will look like over the 4th of July holiday and some of the tactics in the weeks following that. But I wanted to share, if we could, the public service announcement. This was done in kind by WFTV, which was very, very generous of them. They've also started to run this PSA, and they shared it with the other stations within our market. So we're seeing a couple of the stations start to utilize this as well. Becca will have more information, but if we could go ahead and play that, I'd like for everyone to have a moment to see this.
We're gonna play this. Our speakers in the conference room are tied to the Polycom, so it's not direct to the computer. So we're just gonna drag the Polycom a little bit closer to the computer in hopes that you guys can experience the full audio.
That means our businesses and consumers are following safety protocol by wearing masks, washing hands, and practicing social distancing. Let's sustain that sense of community together.
Lucas, we can hear it, but I don't think we can see it.
Our sense of community makes it stronger. Let's keep the God in mind. Simply real, safer, and stronger together. Learn more at superpartorl.com.
Okay, we hope everybody was able to act accurately, or adequately.
Okay, well, this video is also on the website. So if you go to www.doyourpartorl.com, then you'll see the video right there on the homepage. So I encourage you all to go ahead and log on and take a look. So I'm going to. Yes?
Ms. Martinez, did the spot not play? Did you see it? Were you able to see it?
Not see it.
Not see it. Okay, let's just try that again.
Okay.
Apologize for that.
So Lucas, if it's on the website, can we bring the website up? Yeah, we can see it.
Wait.
There we go. Now we see it.
Wait. Can you not see that?
We see it.
I agree. Go ahead.
As Central Florida continues to reopen, doing your part to add up for the safety and protection of everyone's health, we all have a hand in doing our part. That means our businesses and consumers are following your safety protocols by wearing masks, washing hands, and practicing social distancing. Let's get better than social security because you're in Central Florida during good times and hard times. We're stronger. Let's speak to the guidelines. And when we go, we are stronger together. Boy, do your part at ORL.com.
All right, hopefully you heard it that time.
Thank you. I think that time we had the opposite problem. We could see it, but
audio.
not as good. That's well, again, if people would just go to the website, then you'll find it right there on the homepage of the website. So Becca's going to go ahead and give you some more information on the tactics that we'll be using in the coming weeks. Becca?
Hi, everybody. I am Becca Beatus with Visit Orlando, co-chair with Lorraine. So as she said, we launched on Friday with Mayor Demings. There was a lot of great support. It gave us some really strong momentum going into this pre-4th of July week. We had over 24 stories, 20 of them here in the local regions. So the media was extremely supportive on the news side. Social media, we've had a lot of great pickup, a lot of great engagement. We've had over 160,000 impressions locally. Still on this one. And so we started with a really strong, this was just since Friday afternoon. So we had a really strong push this weekend. And then our focus this week is to continue that momentum with all of our partners so it doesn't die down. So for that, we'll go to the first slide. So one of the great things we love about the logos, we made sure that we could alter the template and keep the brand look still consistent. So today we developed a red, white, and blue one for the 4th of July weekend specifically. So you'll see some art. I think the next one is in Spanish and Creole, right? If we move ahead. So Lucas, if we could move it ahead, the slide. Yeah, there we go. So there's the Spanish and the Creole. So we've got, this is all pre-4th of July tactics, which I'll go over soon. But it's really geared just toward this week. Same thing as we're doing this, other companies are looking at how they can alter this with their own corporate colors, their own corporate. So that's the great thing about this is we're doing one consistent look, but everybody can personalize it the way it's right for them. And we're using it to really push for 4th of July. So if we go ahead. So something we're so happy with, the mayor and Roseanne pulled together a media advisory task force of executives from all the media throughout Central Florida region early on in this process. And throughout that, as well as our own advisory committee, they've been so committed and so engaged. As Lorene said, WFTV created that PSA spot for us at no cost, shared it across the lines with the other media as they want to edit and use as they see fit. And they are continuing this week. We've been working with every single member of our advisory task force and really following up and seeing how they can continue this story. And you can see WFTV committed to spots now through July 11th, a very heavy rotation plus social media. Fox on their stations as well. Wesh just came through this afternoon and committed to their schedule. They're doing another 60 or 70 a week. So that's a total of now, as we're heading into the 4th of July weekend, almost 250 spots throughout our local TV stations, all concentrated, all donated at no cost. So a huge thank you to our TV partners. They are really just supporting us, supporting the community in such a strong way. So look for that. You'll see that over the next few weeks. And then if we go to the next slide. Social media has been a big part of this campaign because it lets us really engage with the residents. So there you can see the mayor did a personalized video with his mask, which that performed extremely well on social media. And the team, the Orange County team, is doing some great work with other figures throughout the community. I think they're working with Mayor Dyer. We'll be working with some of the soccer athletes and really everybody using these custom masks in the campaign and helping to spread the word. And then for this 4th of July week, we're also looking at some fun things we can do with the 4th of July masks, maybe some giveaways. and really have fun with the campaign. It is a very serious message. Everybody's in a holiday mindset, so let's just tap into that and make sure when they celebrate safely. It can still be fun, but it has to be safe. So social media, you'll start to see a lot. We're also using social media and Yelp to positively reinforce businesses that are engaging. We talked a lot about this at the Economic Advisory Group, the larger group, and I know they were keen on that, of using that positive reinforcement and maybe peer pressure a little bit from consumers, have consumers use their voice. So starting this afternoon, we're doing a call out on all our social media channels, the county's channels, asking businesses to let us know if they've made this pledge, and consumers to ask us if they see and know any businesses that are really taking visible safety measures that we can give a shout out to. So if you go to the next page, the next slide. Yep. So this is, it's hard to see. It's just, this is a screenshot of the web page. There's a whole section on the web page, doyourpartorl.com. That's a tag board where we layer in all these positive posts, either from businesses. You can see some great iDrive attractions there, Fun Spot America, Icon Park, everybody who's engaging and pledging to be safe through this program. So we take, not only do those businesses get exposure on the Orange County channels and Visit Orlando and Orlando Economic Partnership channels, because we always share that, we're sure to do that. We also highlight it on the webpage. So if consumers are looking for businesses that are really having a positive shout out and how practicing safely, business safely, they can always go to that page as well. So that's starting to be really popular. And again, just another way to use the power of our channels to support the businesses that are doing their part. Go ahead. And then Laureen can talk a little bit more about some of the more outdoor media visibility we'll be getting over the next month or so.
Thank you. So there are a number of different organizations that have committed moving forward to also engage with the campaign. So if we'll go to the next slide, I want to show you something that you might have seen if you were out on the roads this afternoon. But right now, Clear Channel has donated 17 digital billboards around town. So here are some screenshots of what that looks like. So you can see the message very, very clearly there on the billboard. So we're very grateful for them for doing this. They will be using this billboard for the next month. So they've agreed to have this up for at least 4 weeks. So that's great news. Something else you'll see this week from the Orlando Business Journal on Friday in their edition, you'll see an ad with this messaging, and then there will be another ad that will be published on July 17th. We are talking with the Orlando Sentinel to do some digital advertising, mostly on their website and included in some of their e-newsletters that go out. So that will have a far reach, we believe. And so thank you to the Orlando Sentinel for agreeing to do that in kind for the campaign. Another close partner, of course, on the healthcare side is both Advent Health and Orlando Health. So both have agreed to support the campaign. Advent Health, for example, is helping to provide content for us. They have over 500 blogs already written on the coronavirus and some safety precautions that people can take. So we've got very rich content that we can draw from. They're also going to create and co-brand social media promotion that is based on a mask. So we look forward to working with them, and we could potentially see the light board over on the Amway Center with the message there. So thank you to both Advent Health and Orlando Health, who are doing their part with their own internal channels as well as their external channels, and particularly on the social media front. We also have a partnership with Lynx. So we are creating artwork as we speak that will be used to wrap a bus that will go around the Orange County area, and that will have the Safer, Stronger Together message as well. So there are a lot of businesses that are stepping forward, a lot of organizations in town. So we're very, very grateful to them, and we're continuing to see more organizations get engaged with the campaign. So I'm sure in the very near future, we'll have even more to share on what some of those great partnerships bring to the table. So Becca, I'll send things back to you.
And just for everybody, we're going to put
sorry.
the video in the chat so that everyone can
Okay. I'm sorry.
Also have it up on our website as well.
I'm sorry, I missed that comment.
Oh, I'm sorry. Did you, Becca? It's over to you so you can talk about reaching the college audience, which is so important right now.
Yeah. Okay. Okay. So, as we said, we're really focused on the college audience. This is a new layer. Now that we've launched the campaign, we're adding a subgroup to really focus on the younger audience, specifically the colleges, working with them. So I know we have representatives today on the call from the student teams. We have, if you can fast forward to go to the next slide. We've had some preliminary calls already with some of the local colleges, with particularly Valencia. Jay's on the call, and UCF. We had a great call to kick that off, and we reached out to the Rollins folks. Tomorrow, we're starting wholesale and Florida A&M and some of the other local colleges, just seeing what programs they're doing. Some of them already have their own safety campaigns, and we're looking at how we can support it. For instance, UCF has their Armor Up campaign with the UCF mask. That's a photo right there. They have some special masks custom made. So we'll be looking at how we can support that, whether it's using the mayors to do a short video in the mask, or what content can we give them that's supportive of UCF. Some, I know Valencia mentioned they were really interested in using the campaign that we've got now and echoing that on their channels. So it's, each one's different. We're just working to see how we can reach those channels in a way that serves them the best, whether it's support content they already have or help give them content. So this is its very early stages, but of critical importance. So you'll start to see definitely more results, and we can report back on that. I think that was about from the colleges. So social media will be a big push. And then the other element we know is these are the official corporate channels for the schools. But we also realize it's important to create content and reach channels through non-traditional measures when you reach the younger audience. So that'll be another big focus that we'll be wrapping in all of our social media teams on. Would love to work together with the student representatives who are on this call as well and get your thoughts, because we know to be really authentic to this group, it takes the folks that are talking about the program, but also those that know the audience so well. I think that really sums up, I believe it's our last one. I think that's our last slide.
So I know we have some of the college students on board. And first of all, if I could make a comment, this is Roseanne Harrington. And I just want to take this opportunity to welcome the college students to the task force and the working group. I know with us today that we have Sabrina La Rosa from UCF. We have Manny Rodriguez from Rollins. We have Julian Maynard from FAMU. We have Danaya Elisa Green from Wholesale and Esther Percival from Valencia. And just want to thank you all for participating and being here with us, and just wanted to see if you had any comments about the campaign.
Hi there, this is Sabrina La Rosa from UCF. I think the campaign is incredible. I was actually texting my director of communications. We were filming our return to campus module, getting the content for that. And I was asking her, I was like, I wonder if this is something that we should include in it. So I think that's incredible, and anything that we can do to collaborate to really send this message to students is incredible.
What about the messaging? Do you feel like we're going in the right direction? What can we do to reach the younger audience? Because we seem to see the numbers going up in that area.
I think primarily focusing on that community aspect, that's something we're really honing in on. I know we're really trying to exemplify our community and armor up for one another, not just for ourselves. And we're really trying to express the fact that campus being open, along with all the other restaurants and entities nearby, are dependent on you wearing your mask and, you know, participating in social distancing to the best way possible. So I think the video looked great, and I think that's something we would implement into our return to campus training for students.
Any other ideas? What about any of the other schools? Is there anything else that we can do?
Hi, my name is Esther Percival, and I'm from Valencia College. I just want to say that one, I do want to reiterate what Sabrina LaRosa said. I think everything that she said is on point. What I would say is pertaining to the video that was shown, I think that if we really do want to get the message out to particularly a younger audience, which are the college students, is to make it explicit, make it very known, because I feel like watching that ad, I do get the message that's being put across, but I wouldn't know that this is a message that is not to say that it's explicitly for college students, but I know a lot of students my age would just brush it off because it's not explicitly stated that this is something that I need to pay attention to, which is something that a lot of students may do. So I feel like having it kind of like explicit, like we want to connect with you guys and we want to like get this message across to this younger audience would be beneficial.
That's a very valid point. I was on the UCF website today, and as soon as you land on the landing page, they've got pictures of students around the campus wearing their mask and doing fun stuff with mask on. And so to Esther's point, I think, we need to consider how we can make it a little more relevant to our target audience.
And Roseanne, this is Chuck. You and I spoke yesterday. I think one of the problems, I have a daughter who goes to UCF, and like we talked yesterday, one of the problems with this age group is so many of them. She's got 4 or 5 of her friends now who have tested positive for COVID, and none of the kids have any symptoms whatsoever. The only reason they know they have it is because they got tested. So a lot of the problem with the colleges are the kids have it, they don't know they have it because they have no symptoms, so they're spreading it, without knowing that they're spreading it. And so is there a testing program that's hitting the colleges? Because I think if they knew they had it, they would behaviorally be a little bit different. But I know all my daughter's friends, they're all out on the lake and they're all playing and they all think they're fine. And then all of a sudden they got tested and they're like, oh my gosh, we have it. Now they've quarantined themselves for 14 days, but they had no idea. And I think that's a big problem. Aside from closing the bars down, these people are going to congregate, and if they feel they're well, they're going to feel they don't have a problem. And then they also don't know, once they're tested positive, are they really supposed to quarantine for 14 days because they can't tell when they're better? So do they go retest for 14 days? I just don't think that message is out there to that group very well.
Roseanne, you're muted.
Check while we're waiting. My daughter goes to FSU. Exact same questions you're talking about right now, or what I hear from her friends. Well, when can I go back? I want to be responsible, but I'm not sure when I'm okay to go back, or do I have to get a test again? I think I'm hearing the same thing.
I wonder, Becca, if maybe one element of the campaign specifically directed to college students is the encouragement of getting testing. I almost think it's going to seem like a weird analogy, but the first rule of gun safety is any gun you see, you should consider it's loaded. And I think until you've been tested, you should assume and act like you're positive.
So it's a reverse rather than assume you're fine until you're tested. Is there a way to? I don't know the mechanics of this. Is there a way to do? Or are we already ramping up testing, to Chuck's point, specifically around the colleges, that we can help communicate that?
I believe the county has done that, but I don't have that information. But I believe there was some stepped up testing, like in the Carillon neighborhood outside of UCF, as an example, to try to make testing more available to the students who are living around campus.
So if I could ask the students some questions here, we're talking about the testing. Do you feel that there's there's a need to push the testing, or because we're just trying to figure out the right way to reach the very important demographic? If you can just give us a little bit more direction on, but there is testing available, and there's a lot of opportunities to get it. We've been out near GCS and downtown and the different districts. I know that we do have a problem with, there's been a longer period of time to get test results. That has really kind of messed things up a little bit, and the state is putting some new resources in that's going to hopefully get done, and some more lab testing that's going to allow us to shorten the period of time it takes to get results, which should help. So I did check on that for you, Chuck. That was your question. But what else can we do? The students, if you can kind of weigh in, hate to put you on the spot, but if you'll just give us some ideas.
Roseanne, this is Sam Stark from Rollins. I obviously can't speak for the students, but I can say that from the college's perspective, it's unlikely, at least, that we will be doing a lot of testing on mass testing, only because it's such a snapshot in time that once they get tested and get the no, and they walk across the street to Park Avenue, all bets are off. So we're going to be spending a lot of our time and a lot of our resources and communication on sort of the symptoms management and communicating that. We're giving every student multiple masks, hand sanitizer, and a thermometer, and we'll be coming up with some sort of symptom test every day that they need to do check-in with us. So that's sort of the basic approach that we're going after. We have tests, we will have tests, tests will be available. But again, it's just the guidance that we've frankly received from partners both at Orlando Health and Advent, and if they're on the phone and feel otherwise, they can share it, but is the testing when you walk on campus, unless you're going to do it every couple of weeks, regularly for the entire semester, the testing just isn't the place to deal with this. It's more about the education and the communication, which we'll be very vigilant about.
Hi, I'm Jessica Henlon with Full Sail University. I'm the director of. So not that I can speak for students, but I do love the campaign. I would just recommend reaching where they are at on social media. So I find that a lot of our students love Snapchat and Instagram, whereas my generation were more Facebook. So if you can pull them in where they're at on social media on their channels, TikTok is another one. And then they usually respond to the interactive piece. So I heard you mentioned giveaways. If you can tie in challenges, giveaways, trivia questions on social media, that will pull in the engagement.
I like that idea, and piggybacking off of that, maybe we can engage them to show us their best pitch. Maybe they're promoting it for us, maybe they're recording a little ad for us, or they're catching their friends wearing a mask and doing the right thing. So going back to catching people.
Yes. No, you're right. That's actually, it reminds me of great, one of the ideas that came up in the task force was exactly that, of engaging the kids. We were just starting to spend a little bit of time. And actually the word they used was, it was somebody younger than me. They're like, yeah, we got to catch them with the Superfly masks on and then hold them up, because it's about kids having fun. I mean, yes, it's like the 4th of July message, right? It's a serious message, but you also need to have fun. And that's something we find at Visit Orlando with the visitors, right? They want to know about safety, but you can do it in a fun way also. So I think that is such a great idea. Maybe we could work with, because then you're getting that user-generated content that's direct from the students, and it's starting to become more of a fashion accessory. Right now, everybody's starting to say, like, how can I do a mask that expresses my own something about me personally? Rather than just grabbing the blue surgical mask. So.
Thanks. Thank you. I wanted to mention that. I wanted to ask a question to the college student, the college representatives. I'm assuming that when the children, the young people, I'm sorry for calling them children. Young people go back to their places of abode, that they are going to be tested, right? Is that the strategy, that they will be tested before they return home?
Pastor Zach, if you don't mind, I'm Reginald Green with Florida A&M University College of Law. We are kind of like Mr. Stark said, many of the students are waiting a couple of weeks before school starts because they understand that that test is simply as accurate as it is at the time. So a couple of weeks before. The concern that many of them have at the law school, of course, is then waiting for the test results. In law school, and unlike some of the universities, there's only a required amount of absences they have, and even if we do this online. So they're concerned about their attendance, and it starts the testing kind of starts running into other issues. And so what we're trying to do is make sure that we come up with avenues and alternatives to make sure that they are not at disadvantage by taking the test, because if they see a disadvantage, then they're going to run away from that testing opportunity. And I agree. I was about to laugh when Ms. Hinton said that her age group was Facebook. I guess mine must be Face the Nation, because I do none of those. But it is, I will tell you, I have daughters ranging from 30 all the way down to my youngest, who is in high school, and I will tell you that they communicate through Snapchat, Twitter, and Instagram. That is it. Those three are like the young folks' Bible, and that's where they consume the information. It's where they consume their news, and it's the way to kind of drive the message home to them. So I would strongly recommend that. Law students, of course, are some are older. Our median age has been climbing over the years, and so they have families. They're in the community. Some of them are concerned with work issues and whether they have to miss work if they're tested, and how that's going to affect them and then affect school. So there are a lot of factors, and so testing is it, and we're just trying to create processes that allow them and encourage them to get the testing.
Okay, so maybe we need to facilitate locally a avenue that makes it more user-friendly for them to be tested, especially when they're returning home. But I would think that needs to be mandatory.
Chairman Zach, this is Fred Kittinger from UCF. Just wanted to share with you and the other members of the team here. On July 6th, our COVID self-checker goes live on our UCF mobile app, and that's for all of our students, our faculty, and our staff. It's a way for us to push out daily information. It's got the self-checklist on your temperature, things to be looking out for, et cetera, what to do if you are testing positive. We have a reporting mechanism coming to university if you are positive or someone near you has been positive. So we've got that COVID self-checker, like I said, going live on July 6th. And one other note before I forget, for Lorene and Becca, do you know on your media partners, was there any involvement or reach out with WUCF? If not, love to see who I can connect them with your old team regarding those PSAs.
I'm not sure. We did not, and that is a really good point. They might have been on an initial advisory meeting with the mayor, the larger one, but absolutely would love for you to connect us.
Okay.
Well, I think Telemundo, I can help you connect with Telemundo, but I thought Telemundo was on the committee with you guys, and I don't see him as a media partner.
Telemundo was on, yes.
Yeah, we need to get this out to the Hispanic audience.
Yes, no, they are. So those are the three that I had were just examples. We reached out to all of the individual stations, including Telemundo, over the last 2 days, just to say, now that we're launched, we'd like to follow up with you on your commitments. Those three that I highlighted, WESH, WFTV, and Fox, those were the ones that just came in over the last couple days. So that is not comprehensive. So that is just a start on that. So I fully expect over the next 24 or 48 hours, the rest of the stations will start to come in.
And I want to add that we also translated the public service announcement, and we did send it to all of the Spanish language, including radio, so that they could then take that and record something in Spanish on their own if they so chose, or if they could, use elements of that in their broadcasts. And I should say we also did that with the Creole media, because we do have a presence of Creole media as well.
Thank you all for everything that you've done on this campaign. We really appreciate it. Thank you.
You're welcome.
Absolutely. And I think, Pastor Zach, that went into the second part on compliance, because that's what we've been talking about. So I think the only thing, or the thing I'm taking away from this, is definitely the campaign. It's something that we had requested, the wall of fame and everything, and it's coming together beautifully. You guys are doing an amazing job. It's appealing. It's it's fresh, it's new, and I think if we engage the younger audience, I don't think we're going to have issues with them embracing it. So thank you for all that work. Thank you for that creativity. It's completely amazing. The other part of the conversation that I heard, which I think it's maybe a secondary, assume that you've got COVID until you've proven that you don't. And so maybe the secondary part is always wear your mask or something with the students. I don't know. I don't know how we do that, but it sounded like it's important to have students, to have that demographic wear a mask, irrespective of whether they've been tested or not, or they have symptoms or not. Okay.
Evelyn, I think it might be important too for the colleges that, the kids are so much, I'm saying the same word, the young people are so much at less risk than people who are older. And like what my daughter is dealing with right now, all her friends got it, so she doesn't know if she has it. She's waiting for her test results to come back. And she said, Mom, I'm going to stay away from you for, till my test results get back. So if the colleges could let the students know that they really need to be cognizant of their parents and their grandparents, because the kids are going to spread it amongst each other, and a lot of them are never going to know they had it. But taking it home adds a different level of risk to the parents and to the grandparents. So, part of those messages should get out, to the kids that, hey, you may not think you have it, but you need to take care of your parents. And really, I think, I'm forgetting the name of the one gentleman who said it, but he's right. Everybody does talk through Instagram, Snapchat, text messages. So if they could get some of the major college influencers, the ones who've got the million followers, to let everybody know, it may not be you, it may be your parents you need to watch out for. Because that message really needs to get to them, because the kids around my daughter's group, they're really looking out for their parents at this point. They're all hanging out together, and they're going to do that. They're 18, 19, 20, 21. They're going to do that. As much as we tell them not to do it, they're going to do it. But to let them know, you may hang out together, and you're probably going to do that anyhow. Watch out for your parents. And that message is probably very important to get across, because the age group has been very low. And we saw today the age group cropped up again a couple of years. And as it gets into the higher years for testing positive, it's the higher risk. So, that should be part of the message getting out to them.
Do it for you, do it for them. Absolutely agree.
Yep.
Something else I'd love to follow up with the student representatives on. We recognize we're working with the official college channels, but we also recognize that the kids, they follow, Chuck mentioned influencers. You follow certain channels that aren't necessarily what you would follow as a business leader, or the corporate channels. So those are, just as we've activated our social media networks of businesses that are very highly active on social, it would be great to get some feedback and assistance from the student level of reaching the student influencers, because, whether it's, with UCF, we talked about, is it the UCF athletics team, or the football players, or how can we incorporate them? Or maybe it's just somebody on social who's really popular that we just don't know of, that we could work together with you to outreach to them.
Hi, this is Sabrina from UCF. First of all, I think that engaging different popular influencers, I think that's really beneficial. But students are really focusing on their mainstream line of communication now. We did a campus-wide survey and found out that students like to receive most of their information from our ucf.edu official Instagram account. So students are constantly checking for updates there. And yes, Instagram is our new source of information regarding COVID, because the university is being very adamant and mindful about posting there constantly. I believe the university is trying to engage different student leaders and student athletes to be the face of wearing masks and social distancing. But I also think that some things that we're working on that maybe the city and the county can implement as well. We're doing videos and commentary on why I wear my mask. So like I mentioned earlier, the majority of people don't necessarily wear it for themselves, but for those around them. So your grandparents, your parents, your siblings, someone in your life that may be more at risk. So I think kind of having that personal sentiment to it adds a lot for students. And I also think that educational aspects regarding testing, it can be something scary. Students say that they refer to it as it tickles your brain, and it's a scary thing regarding testing. So I think I know the university is working on an educational FAQ video of what testing is actually like. And I think the moment we stop fearing testing and we are more excited because we know that we're going to heal or we're going to get better and we know what we're being diagnosed. I think that's something beneficial and really focusing on that educational aspect.
So great. Thank you.
Okay. Any other comments, questions, feedback?
This is all really great information that I think will help as we continue to plan. So thank you for being on the call and for providing that insight into kind of your student universe.
Okay.
And just a friendly reminder from the coordination center here that have maybe about 30 minutes left. So really wanted to maybe get into some teeth and have you all discuss some compliance strategies that we can kind of begin to work around and for recommendation for the larger task force and, of course, then for the mayor's consideration.
Yep. And so on the compliance portion, last time we had reporting concerns would go up to the DVPR. We understand that the DVPR does drop in visits and there's consequences, and I think we've seen that there are consequences when somebody's been a big violator. Also, I understand that the mayor can make recommendations to the state regarding vendors that are violators, and he can also impose fines and penalties. And then Dr. Pino also sends out somebody from the Department of Health to observe and do contact tracing. So with that, I'm going to open it up to the group on how you think we can proceed with compliance, what tools or ideas you think we can tap into.
Is Roseanne still with us?
Yes.
Yes, I am. Yes,
Hey,
I am.
Roseanne, after Halsey put out his tweet last week and then his executive order, I called the department to speak with them because there was a piece of his executive order that was unclear. And he stated that bars had to be closed and couldn't serve alcohol. But he really didn't point out whether bars and restaurants, how they were treated. So when I talked to the department, they said if you're sitting at the bar in a restaurant and you're eating, that's okay, but they just didn't want people gathering at the bars and restaurants. And I really think there needs to be some clarity to his order because it's just not clear if you read the order. And you know, a lot of the restaurants around are having people sit at the bar still and eat. They're separating them, they're putting some distance between them. But I would hate to see someone get in violation on an order that's unclear right now. And the order is certainly unclear if you read it.
So I think the big issue is the capacity. The restaurants are supposed to be at 50%, and we're seeing more than that. And I think that's what DPPR is really looking at, is when they say that they're the ability to social distance. Well, if you're supposed to be at 50% capacity, you should be able to social distance. And if you're above that capacity, that's what they've kind of been monitoring. But this is kind of a fluid process. I know Carrie Barnes from the Florida Restaurant Association is on the call, and I know we have some other folks that may be in the industry around restaurants. If you all can weigh in here, this is one of the challenges we continue to have is restaurants. You know, the bars are closed down now, and it's supposed to be if you get 50% of your revenue from alcohol, then you're a bar, 50% or more. So what can we do for these restaurants and then these big gatherings of people where we see them not wearing masks? And we have the holidays coming up, and we're really concerned because this is what happened at Memorial Day. You get together for picnics or things in your neighborhood, and you have 20, 50, 60 people. Nobody's wearing a mask.
Oh, no. Is it going to be hard to get home?
Hey, Steve, you're on.
Okay.
Hi, Roseanne. This is Carrie Burns from Florida Restaurant and Lodging. You all can hear me, I hope.
Hey, Steve Jameson, you need to mute.
Thanks. Yeah, I got a couple minutes. Thank you.
Good. Hi, Roseanne.
Go ahead.
Carrie, you're muted.
Carrie, I think you're muted.
Okay. I wanted to say that Chuck brings up a really good point, and what people sometimes aren't following, and it's easy to not follow, is when the new executive orders come out, they're extensions of the previous executive orders too. So for restaurants, they are allowed to have that bar top seating. I've actually recommended to a lot of my members that they try to stay away from the bar top seating because it's hard to get people, especially in Seminole County, to follow the social distancing piece of it. So we've kind of recommended that if you can get away with closing your bar top, that would be a good thing, a way to prevent having to monitor that all night long. But again, to your point with the capacity, inside that restaurant has to be 50% capacity, and the definition of a bar is 51% or more of your sales of alcohol. The problem I'm seeing in Seminole County, and Chuck, I don't know if you see it there as much, but what I'm seeing up here is we just mandated face mask wearing effective tomorrow. And there are no penalties or restrictions, if you don't wear a face mask. And actually, I was chatting with someone earlier. We actually have a group of people in Seminole County who are calling themselves anti-maskers, who are now getting ready to march over by the county seat because they don't want to wear masks. So I think, to the point we were hearing earlier, we really need to do something, in my opinion, to enforce the mask wearing so that we can flatten this curve.
Hey, Carrie, in Orange County, and I eat out every night, so I can judge this, but right now, I went to Big Fen last night. They had 2 tables in the restaurant. The general public is afraid to go out right now. The restaurants are barely hitting 5 or 10% capacity. So it's not a capacity issue. It probably will become one again soon. But I would be curious, Roseanne, to talk to the county attorney. But, watching national news, I don't know if legally you can enforce face masks. And, we talk about that on these different calls, but I don't know if legally there's a right to do it. It makes sense because people are going to send ourselves backwards if we don't, but I don't know if there's a legal enforceable way to make people wear face masks.
Dylan, are you still on the call?
Yes, Roseanne, can you hear me?
Yes. Yes.
Okay, great. To answer Chuck's question, it's a matter, and we're definitely looking into it. We didn't include an enforcement provision in our order. That was from direction by the mayor. He didn't want to make it enforceable by law enforcement yet. He has said it's a measured approach, and right now he wanted to seek community compliance first and see if that would work. And so that's where we are right now. But Chuck's right. It's a legal issue. I know Alachua County had a face mask order. They were sued in federal court, and I think they were eventually successful. But Osceola had an issue several weeks ago, back when this was first starting, where they had a face mask order. They were sued, and then I believe they removed their enforcement provision. Seminole County's order that I think Carrie was talking about, their order also makes it voluntary for now, but could possibly be enforced in the future. And so that's where we are, where we're in a similar place with Seminole right now, where it's a mandatory order. We're asking the community to comply with it. And then if they do, great. If not, we'll have to reassess.
Reginald, I do know that there are some counties in South Florida who have instituted fines up to $500. I don't know where the legal the basis is for that either, but it's just not we're not all following the same guidelines with that, and so it's a little tough. So hopefully we'll be able to do some enforcing of some sort so that we can get this curve flattened. But back again to Chuck's point and to Roseanne, we are bar top seating is allowed in a restaurant that has a bar, as long as social distancing is adhered to and that people are eating, not just solely drinking. But again, for our membership, we kind of just recommended that they stay away from that if they can avoid it.
If I may, too, I worry about the lack of enforcement or the lack of a penalty from the standpoint of the individual and some of the house parties and large gatherings that we're starting to see. I know just on Saturday, I personally saw a party being held in a park pavilion with probably 20 or 30 people, none of them wearing masks, all drinking face to face. And then on our way home, we passed by a home in our neighborhood that had 20 cars parked out front where they were having a house party. And, you know, I didn't knock on the door to find out if they were wearing masks, but I'm kind of assuming they weren't. So that's where I struggle with the lack of a penalty is, you know, how do we stop people from doing that type of thing, even if the businesses start doing the right thing and enforcing it internally?
Yeah, but we're not in a community of military law. I mean, we can't go to people's homes, and if people are having birthday parties, I think I think it's really messaging getting out, shaming people who are not being responsible. But yeah, we're not in a military community. You know, if 10 people are going to get together, they're going to take a risk, and granted, they're going to go take that risk elsewhere. But you know, I think we're talking about a lot of things that there's probably no legal basis to do any of that. And I don't necessarily disagree with you on that, Chuck. But at the same time, you know, what Dr. Pino has said to us is a lot of the spread that he's seeing is coming from gatherings like that. And I don't know, maybe there's a way to just shame people into compliance, but you know, we're seeing spread come from those type of personal gatherings. And I think that's part of what you're seeing also around the younger folks around the college campuses. It's not just at the bars and things like that, but also parties that they're throwing in their apartments. Maybe it is just a messaging thing, but how we get that message out there to people to let them know that the mandate, even without enforcement, without a penalty, it is still a requirement.
Excuse me. Thank you all for your comments. I think it's great to consider which direction we go in as far as the emphasis. I think the emphasis ought to be on what we can control, which is the businesses complying with, you know, face masks, keeping their numbers down in terms of what we want to see as far as social distancing. And I love the comments about specializing a campaign that's focused on our young people. I think that's important to try to contextualize an approach to that. And I know we're going to be talking about tomorrow penalties. I know one thing that we're trying to ascertain is what will be the penalties for a business's lack of compliance with the guidelines that we've laid out. So I know we're going to try to put a little bit more teeth in that approach. So I think we have to deal with the things that we can basically deal with. You're right; it's hard to regulate an individual, but we can deal with the businesses, and that's going to be our focus.
Roderick, I think we actually need to find that out. I mean, before you discuss penalties and what you're going to do on businesses, you need to know if you have the legal right to do that. The business is allowed to be open at 50% capacity, and they exceed that. You know, I'm sure the Department of Business Professional Regulation can, you know, shut them down or warn them. But, you know, I really think somebody at the county should have the county attorney weigh in on what's legal to do here, because you guys may come up with ideas that we're going to do A, B, and C, and you know, those are going to be challenged if they're not legal. So the legality of it needs to be understood.
It was my assumption that there is something that we can do legally as far as compliance and instituting some levels of penalty.
Mr. Chairman, this is Fred Kittinger. Staying with the vein of the carrot approach right now, I didn't know, and maybe this is touched earlier with the social media campaign, but is there possibly a way to have a database of those companies that have pledged fidelity to the safety standards? I'm not looking at something that needs a whole bunch of staff to go out and check the places. It'd be self-reporting, you know, Fred's Bicycle Shop or bakery or coffee shop is adhering to the safety standards promulgated by, the CDC, the county, and the state. But is there a way to have some sort of informal database for folks, whether around college campuses or in our neighborhoods, and if we want to go to a restaurant, we want to go pick up a retail service, and we can quickly look up, and there's folks that have pledged allegiance to best practices.
I think that's kind of what our website and our Wall of Fame was supposed to do, and hopefully the Yelp is going to help with that, because if I'm going to go to a restaurant and I'm looking at Yelp and they've got a rating of not complying, then that's the peer pressure component of it, right? It helps with the education. It helps with the peer pressure. And then if we have the actual website that lists the businesses that are complying, anybody that's not there is not in compliance, would be the assumption.
Evelyn, this is Lorene. That's exactly right. Apologies for not mentioning the Yelp component of the campaign during our presentation, but that absolutely is a part of it. They have agreed to work with us and are putting kind of like a rating system that people can utilize when they go to a restaurant. So we think that would be very effective. And essentially that kind of wall of fame is a way where people can see businesses that are in compliance. In terms of a database, I'll leave that up to you all to discuss. I don't know if that would be something that is necessary on the website. It could be, but I think right now people are listening to people that they know and they trust, right?
Mm-hmm.
So they go and they see that social post from a friend or someone, I think that they find that to be probably the most credible.
I think, Lorene, maybe we can, just kind of thinking out loud here, because the social media, the concept was to use our platforms to highlight these businesses, but that's a moment in time, right?
Mm-hmm. Yes.
So if there isn't like a way to do a database, or that's not, then maybe there's a way we could aggregate those posts specifically.
Mm-hmm.
I don't know, maybe it's on the tag board. We just make the tag board all about businesses now that are complying. So at least you have one archived way, it's not a clean database by region, but you could, in one archived way, you could look at all the businesses that have been tagged or made the pledge.
And read the promise, exactly.
Yeah, and that's kind of the vision of the Wall of Fame that this group had. Right now, it's all everybody who's engaging in the campaign overall, but we could just make that page specifically highlighting businesses.
Mm-hmm. Absolutely.
Because if we can get this to be a movement, then we hopefully don't have to worry as much about the compliance and the enforcement component of it, because we are limited with what we can do there. So make it more of a movement, something that people believe in, something that somebody wants to be a part of, because it's our health. We should all be a part of it, right?
Mm-hmm.
If we can get people to buy into that, maybe that makes the compliance a little bit easier.
This is Stephen Jameson from Malt Millennia. I think those are all really wonderful suggestions. My concern is that in large venues, it's challenging to get everyone to comply now that it is mandated. You can ask people to put them on, but we don't have the power to tell people to wear the mask. We'd have to call the police for that. We can't just throw them out of the mall or carry them out. It's just not that simple. And we certainly don't want to be on a non-compliance list because we have the effort to want to do the right thing, but we have guests that may choose to tell us not to. Now we're going to have to call someone to have those guests escorted out, and it may not happen within the time someone snaps a photograph or posts it on social media, and we're not going to look very good.
What about, so there's two components here, right? So there's a social distancing and there's a mask. So in the absence of a mask, can you impact social distancing? Is it easier to impact social distancing?
Well, for sure. And we have spacers out at all of the stores that have lines. We've created that for food courts. We've minimized the seating in our food courts. We've done all of those protective measures. The hard part for us is the actual enforcement of the mask. We have signs at all of our entrances saying you are required to wear a mask. We have them repeated throughout the center. We have masks available, but some people, and we've heard it before, just choose not to wear them, or they'll wear them when they come in, but then they'll take them off. Now, our stores all require them now, and our stores are enforcing it because they may not serve a guest who comes to buy something, maybe not wearing a mask. But it's kind of hard to do that in the common area or in the parking lot when a guest doesn't have the mask on. To make it mandatory, I don't know how we would enforce that without having code enforcement or the DPPR or Orlando Police Department, scattered around the mall to ensure enforcement. And we don't want to be on a bad list because not everyone's wearing a mask.
I think you're doing well by at least the store owners enforcing it. If at least the store owners are enforcing it, I think you got to win.
If I may say something about compliance, because compliance is a function of what are we happy with in terms of numbers and what is the goal? Are we happy with 300 people getting sick a day or X number of people dying? Or is the number 200 or is the number 50 or is the number 0? So it's very difficult to have a conversation about compliance and not understand what is the real goal. As I prepare for this meeting, I spent considerable time talking to a lot of different countries that have gone ahead of us. Now we can make the assumption that we're very different than Germany or Italy or Spain or Asia, but I would propose to say that genetically we're pretty much the same in terms of how we get COVID and how we heal. And the folks that have gone through this before, their goal was to get 0 cases, 0 hospitalizations, 0 deaths. And they have taken a considerable more stronger approach, both on the reward side and on the punishment side, knowing that to change behavior, you have to do both. You just cannot just be doing reward and telling people I'm being happy. That's a great part and a component, but you have to have the punishment as well because people will now reward to it. So what does this all mean is that I really would love the committee to have a consensus as to are we trying to get compliance for 0? And if we are, that dictates some of the movements and some of the initiatives we want, or do we believe as a committee that this will eventually by magic go away? The truth of the matter is if you look at other countries and what they've done, it doesn't go away. And the ones that have taken it to 0 or to almost very low levels, you have to take some pretty serious steps. And so I would try to at least make my voice known and say, you know what, I think we need to do more. Now you say, well, what do you recommend? I have some recommendations. I don't know if this is the time to share some recommendations or if I should send those recommendations in writing to somebody. But I would love to get to a premise of how serious are we taking this? Do we think it's a major threat? And what is it that we're willing to do on the punishment side and on the reward side?
I think to go with that, though.
I'm sorry.
John, I'm sorry. I know we've got 10 minutes left.
To offer recommendations and just also as it relates to authority and legalities, I am given counsel by the attorneys here that you guys can recommend what you feel you need to for the larger group to consider, and then it will be up to the mayor ultimately on either following that recommendation, amending it, and or doing other things to accomplish the same goals. So just in reference to the question that Pastor Zach mentioned, wanted to get you an answer on that. But yes, right now would be the perfect time to just share your ideas on carrots and sticks to help compliance and consumer confidence.
Yeah, I don't know. There's only 10 minutes left, as the chairman said. So I don't know if you, I think I can take 2 minutes and talk about one recommendation, or we can leave it for another time. It's up to you guys.
Go right ahead. Mm-hmm.
All right. It's actually a very simple recommendation. And I have to say, they're not my ideas. This is an aggregation of some of the things that other folks around the world and the United States are doing. In addition to the great campaign, and I really have to commend the people that were part of the committee and coming up with a great campaign. And I've seen it, and I think it's beautiful. And I thought the one in Spanish and the translation was absolutely on target. But I just think that there's something that we can do that costs no money. Every day we have the mayor come on TV for some sort of presentation of what is going on for the day. My recommendation is about using that as the epicenter of sharing the truth and the absolute truth, and also the platform, just like the pulpit, to change behavior and to tell people this is what we need to do, and in addition to what they already do. For example, some of the countries, what are they doing in this type of showcase? One of the things they do is that they invite to the mayor's news conference 1 or 2 businesses in the community to speak for a minute to 2, saying, I'm business ABC, this is how we're complying, this is what the results we're getting, this is what's working. And of course, the business that are brought and to showcase, these are businesses that we know are compliant and that we can actually showcase them as an example. So that's not only good news to share, but it's also a way to reward businesses for complying.
Okay, I think that's a great idea in terms of testimonials.
It's a testimonial.
Let's mark that down. What's your next idea?
It's all around the mayor, and it's all around this news conference, just to do something that we can start soon, that we don't have to wait 3 or 4 weeks to get it done. The other one is to make wearing masks something super fun. You know, in places like France and Spain, they've actually made masks very fashionable. So they've actually done a contest of cool-looking, fashion-looking masks. So what they do is they do the same thing. They bring these people and they showcase, look at this cool mask, and they actually have contests. Which was the coolest mask? Which was the prettiest mask of the week?
Love it, love it. So let's make mask fashionable. What's the next one?
The next one is that having men wear masks is the hardest thing to do. It was hard in 1918, and you can hear the history and read it. It's hard now. How did they do it in Germany? Well, they started to get the mayor, the city, the commissioners, the big preachers in town, anybody in town, and they started to talk about why men wear masks. So it was an entire campaign that centered around, again, the mayor's news conference, but it had to do with men wearing masks and encouraging other men to wear masks.
Mr. Zach, you're muted.
Okay, I get it. So let's get some popular personalities to evidence that they're willing to wear masks. Okay. Anything else?
That's it, sir. Thank you for listening to me.
No, thank you. I'm sorry I had to try to rush you a little bit. We want to expedite the time. Okay, anybody else have some substantive comments about where we go from here?
Can I just piggyback really quick on what John shared? I love those ideas. I would say tie in the college students with the press conference. If we put some type of competition, highlight them at the press conference. And the fashionable mask, we have several local fashion designers in Orange County that could probably be featured or brought in some way to make masks fashionable and highlight their businesses as well.
Love it, love it. So let's include the young people in the campaign in terms of how we promote it. Okay. Now, I guess we'll wait. We have another meeting scheduled tomorrow, Dr. Cardenas?
Mm-hmm. Yes, we do. Same time.
So why don't we pick up the whole issue of what we can do about some kind of shot across the bow to businesses that are non-compliant. Okay. Anything else, Dr. Cardenas? I'm sorry.
It's okay. I think we're good for today. We've got about 4 minutes. We'll start on anything else right now. We're going to run out of time. Lucas, did you want to include something else right now? Are we good?
I think we're good at the moment. What we'll do for you all is a few of the things that we've heard here towards the end of your discussion, maybe have that on a piece of paper, and like we did before in previous meetings, pull up that Word document and share it so everyone can kind of see the present or the recommendations that you guys are going to bring forth. So homework tonight is to think about your best recommendations, your best carrots and sticks. We'll put together what we feel you said today as a starting point, and then we'll work from there tomorrow, if that's okay with you guys.
That's wonderful.
Perfect.
All right, awesome.
Okay, nobody has anything else? Pastor Zach, I think we can dismiss.
We sure can. Thank you so much.
Thanks, everybody.
Thank you.